Welcome back. As we said earlier, that we are going to tackle the healthcare system in Egypt, challenges facing this sector, and efforts done by the government to reform it. To shed more light on this issue, we are delighted to be joined by Dr. Hisham Omar, a pediatric consultant. Good morning.
Morning.
Good morning, Dr. Omar. Now let's start, since you are a physician and of course you're the best who knows the main problems facing the health sectors. In your opinion, what are the major problems and challenges facing the health sector here in Egypt?
I think to start with is the exponential growing of the number of people born every day with the high incidence of diseases that we are facing in Egypt, and the capabilities of the government / the private sector to look after those people. So we have two things that we should try to overcome in the coming 10 years.
Mm-hmm. Okay, doctors used to hold partial strikes in the last period. So what are the problems that doctors currently face?
The doctors consider themselves victims in the sense because they have spent 7 years studying thoroughly a very difficult subjects, which is medicine, and at the end of the day, they feel that they are not properly paid. Put it as clear as this. So the attempts of increasing the doctors' fees, especially for those who are serving the country in remote areas, is a problem. And at the moment, you cannot ask the doctor to be devoted totally to his, I would say, to his national obligation without paying him properly. So this is at the bottom line of what's going on at the moment. Having said that, a lot of doctors are saying, well, we can sacrifice those things if we are working in excellent conditions. But if you are sent to a remote area, you will be on your own without a senior person teaching you, and you are faced with cases that you might not be trained enough to deal with them. Mm-hmm. This is exactly what's going at the moment.
Okay. Doctor, the issue of healthcare is a constitutional right for each Egyptian citizen.
Sure.
But unfortunately, the majority of Egyptian citizens don't feel that they are actually receiving such constitutional right.
Sure.
In your opinion, why is that?
The same is applied on learning and on the issue of education. Everybody has the right to be educated, but look to who are really receiving the proper education at the moment. So we have to face ourselves and say, can we do this as a government? And is any country in the world, apart from possibly UK, is capable of teaching people and treating people? But in this part of the world, people are really paying huge amount as taxes, something that we are not doing here. So everything on the shoulder of the government. So you have to face the fact of saying, well, enough is enough. We have to look for the needy people who needs education / health care, and the rest of the people should pay for their service.
Okay, can you tell us more about the role of the private sector in improving medical services in general?
As you know, especially in Egypt, mainly the doctors who are really doing the big effort in treating people, I mean on the level of the street, is in the private sector. But this is a sector that should be stratified properly, because we would like the governmental institute to do their job that they are doing at the moment, or even more. The teaching hospitals to be a place where educated doctors are coming to the market every day. But the government should look to the private not as a competitor anymore. They should look at them as a complementary part of the health service. We should be partners.
Yes.
And on every level. On every level. The private setup that I'm working in is in, I would say, well-to-do place in Egypt. Yet, we are facing people who are extremely poor, living in this very community, and they are coming to the place where we're working, and we would really want to be partnered with the government so that we serve them properly till they are assigned to the place where the government is allocating them for. So we have to work like partners and not like competitors.
Okay. But sir, still, if you go to a private hospital here in Egypt, you would hear complaints every day. So even people who can afford to have proper health care here in Egypt, it seems that there are still problems facing the people. Even the people who can afford to have expensive health care.
Sure. If I tell you that in the area of intensive care in Egypt, we are lacking of 1,000 beds, 1,000 hot beds that is serving for the acute issues in Egypt. I would say because Cairo is the capital in Cairo. So imagine a person critically ill going to a high-tech private hospital, and yet there isn't a bed for him. He's still queuing to be served. Therefore, if we are now suffering from people that are suffering from health problems, and yet there isn't bed enough or doctors enough to look after them, this is a problem. So what we need to do in the near future, I would say, let us say the coming 10 years, that we have to build in partnership with the government a lot of private hospitals that is having a 20% or 25% of is as insured hospitals, so that people can go there automatically. And we will do it with a very high-tech way that the people will know before going to a hospital if there is a vacant bed or not. So we have to have a central piece of information where you call a hotline and say, my father is suffering so and so. He would say, well, the chances that you are having in this hospital in this part of Cairo, and in South Cairo you have another vacant bed, and so on and so forth. So you don't need to drive to the hospital and then take your chances and then waiting in a queue and then being people will have to admit you. So they will admit you, but they will not look after you properly, because the nurses that are doing the job are supposed to be 1-to-1. They will be 1-to-2. They will be 1-to-3. So you will call the nurse and she's very exhausted. You will call the doctors. He's doing serving another patient.
Yes.
So you have to have something that is like the emergency cars now, the ambulance now. You call a central number, and the ambulance will not, as in the past, sending you from the central place of the ambulances. No, ambulances are like now the traffic cars. They are called and go as quick as they can. We need to do something.